welcome everyone again. I'm Mariangela Pellegrini. I'm the patient and educational manager for the ERN-EuroBloodNet. So I'm really pleased to welcome all of you on behalf of the ERN and the European Haemophilia Consortium to this last session of the educational program named Topic on Focus from Willebrand Disease for Patients, Organization and Healthcare Professional. And indeed, it has been a great joint program coordinated by the ERN and the EHC, so the patient umbrella organization that has been represented by the EHC von Willebrand Disease Committee and patient representative, among who the IPAC by Zimele. And so this program has been also created in partnership with EURORDIS-Rare Diseases Europe and also supported by the member of the scientific committee like Professor Sophie Susen from CHU de Lille in France, Professor Jeroen Eikenboom from Leiden University in the Netherlands, and Professor Flora Peyvandi from the Foundation Ospedale Maggiore Policlinico in Milan. And before entering into the detail of this last webinar, I will pass the floor to my colleague Daria, who will introduce the EHC and explain a little bit the idea behind the program we had almost more than 1 year ago.
Thank you so much, Mariangela. And indeed, it's difficult to believe that it's the last webinar that we have within the framework of this educational program. And probably today we'll speak a bit more than usually just because it's the last one. So my name is Daria Camilli. I'm Education and Communication Manager at the European Haemophilia Consortium, or the EHC. So a few words about us. We are an international non-profit organization representing 48 national patients organizations for people with rare bleeding disorders from the European region defined by World Health Organization. The EHC represents approximately 120,000 people diagnosed with rare bleeding conditions such as hemophilia, von Willebrand disease, and other rare bleeding disorders across Europe. Among those, von Willebrand is the most common bleeding disorder, affecting up to 1% of the general population. However, it is still often neglected and overshadowed by hemophilia. And at the EHC, of course, we conduct huge work on supporting all bleeding disorders, including VWD. And here I want to speak about more what we do. And of course, it's also all about the committee, which we set up in 2020 as the working group, and it then developed. And now we have the representatives being here and participate in the creation of this program. The work of the committee and the EHC in general in supporting VWD lies in three directions of work streams. It's education, awareness, engagement. And there have been a number of projects, and there are a number of projects in the pipeline to come. And of course, I want to mention here a beautiful awareness campaign which we made. I put here the heart, which represents the community. We started this campaign back in 2023 to raise awareness about psychological aspects of living with von Willebrand disease. And this is a bruise in the shape of a heart. And then this heart became a symbol of the community. And last year, when we launched this program on von Willebrand Disease Day, we also unveiled this bruised heart as the symbol of the European von Willebrand Disease community, together with the motto. I also want to mention that in September 2025, the EHC holds the first ever von Willebrand Summit. And to all patients present here from the EHC members, please reach out to your national patient organization if you want to join the summit. And of course, follow all initiatives that we have on the EHC websites, and specifically on community website. there is a page dedicated to One Willebrand Committee and their beautiful work and all the possible projects that they have and are going to have, of course. So please stay with us. And here I want also to take the moment to thank all community members who have been supporting the work of the EHC, and of course to each and every EHC Von Willebrand Disease Committee member who have been involved again in the whole work. And I know it means a lot to us and to you as well. And of course, my huge thank on behalf of the EHC goes to the ERN for this collaboration, for supporting our initiatives, for deciding to create this project together. Another thank you goes to all clinicians who collaborate with us, not only within the framework of this program, but also in everyday life, because we do collaborate very closely with all clinicians involved in the research and support, also clinical support of von Willebrand disease patients. And with this, I want to tell a few more words. I'm getting emotional about this program. So as I said, we wanted initially with this program to shed light on the particularities of von Willebrand disease, to distinguish it from hemophilia, to focus on particularities. And we already discussed all possible topics related to von Willebrand disease, including access to treatment care, genetics, medical services available in Europe. We discussed maternity. We discussed surgery. We discussed everything. And now, of course, as the wrap up, we want to discuss the quality of life. And I think it's the topic that you will truly enjoy. I give the floor back to Mariangela to talk about more technical things about this specific webinar, and then I will be happy to introduce our patient representatives. Thank you so much.
Thank you, Daria. It's difficult to pass to the home rules after this very nice speech. Thanks so much. I'm really grateful, of course, to all the people you mentioned and to you in your organization, because without that, it would haven't been possible, this program. So thank you very much. So home rules. This program is accredited by one continuing medical point of accreditation by the European Board of Accreditation Hematology. How to request it? Very easy. You participate to the webinar and then you will receive an email from our site telling you about how many credits you will be awarded and the process for doing that. So you will receive instruction. Then your microphone will be muted along all the presentation. This session is recorded, as you are seeing. So please, if you don't feel comfortable with that, switch off the camera or change your name in the platform, for instance. And for the lecture, at the end, we will have a Q&A session. So your question will be addressed, or comment, feedback at the end of the presentation. As usually, we have multiple speakers for the session in order to provide really a comprehensive vision to the topic. As said, today we are going to talk about improve the quality of life of von Willebrand disease patients and people living with von Willebrand disease. So I have the pleasure to introduce the first speaker, not in order of presentation, but just in order of the presentation, not of the lecture. So I will present Linda Myrin Westesson. Sorry for the pronunciation. He's a hemophilia nurse specialist at the Hemophilia Comprehensive Care Center of Sahlgrenska University Hospital in Gothenburg in Sweden. She's an expert hemophilia nurse specialist in hemophilia, of course, and her work is really diverse and encompass different responsibility. And I pass the floor to Daria for introduce the other two speakers. Thank you very much.
Thank you, Mariangela. It was great pleasure. So today we have two patient representatives, and they will give interesting different angles from different perspectives. So we have Annabel Kattai. She's an active VWD advocate of the Estonian Haemophilia Society. And we also have today with us Cathy Verbraeken. She's the EHC Willebrand Disease Committee member and Dutch VWD Committee chair. And just to mention that I forgot that Annabel was also in the EHC Willebrand Disease Committee. And we start with Annabel, so the floor is yours.
Yes, thank you. I'm gonna share my story. I hope you can see it. So, first of all, I'm gonna say that I'm really sorry I'm not good at English, so I hope you can understand me. So, I am the patient with von Willebrand disease. My grandmother, mother, brother, and sister also had the same disease. I was diagnosed with a bleeding disorder von Willebrand at the age of 4 when I was admitted to the hospital. I remember it clearly because it was the also worst day that my brother and I could go to the McDonald's. And it was a really rare thing because we are living in the village. So when I was diagnosed, my symptoms were only nosebleeds and minor bruises. So despite my condition, I lead an active life, engaging in sports like volleyball and running. I was also part of the Estonian women's volleyball team for about 12 years. I used treatment only to turning bleeding episodes, but it eventually shifted to a twice weekly prophylaxis. So factor also had to be changed with prophylaxis as the body no longer accepted. There were also allergic reaction, epileptic attacks. I have already changed the factor 4 times thanks to the reaction. However, around the age of 18, I started having internal bleeding, which I didn't understand at first and thought it was a muscle cramps. As the pain became more and more intense, my mother took me to the hospital, where we found out that I was indeed internal bleeding. From then on, I couldn't play volleyball anymore because every stronger ball hit caused more bleeding. Transition to the larger hospital and adapting to the environment took time, but fortunately, I found supportive medical staff. Prophylaxis became my routine, and in 2022, abort eased injections. Life with the board was great. I had the opportunity to go traveling, and I didn't have to fear. I could inject the factor into myself if needed. Let's say I read it was completely independent and no longer needed my mom's help. I recommend it to anyone who has poor vein paths and is given the opportunity to install a board. Unfortunately, an injection led to its removal in 2023, taking a toll of my mental health as it returned to regular cannula injection, which I fear due to the pain. Although I'm afraid of installing a cannula, it doesn't bother me living. I have the opportunity to still bake with it, go to school, and so on. I am currently studying to be a nurse and working as an assistant nurse in the Department of Hematology of the Northern Estonian Regional Hospital. My openness about being a girl with a bleeding disorder garnered attention. Faced with misconception, I embarked on an educational journey, sharing my story on social media, conducting lectures at school on how to spot, recognize, and care for the person with the bleeding disorder, and participating in awareness campaigns. I aim to educate others. It's rewarding to know that my efforts have helped others to get diagnosed and treated. On top of that, every new person who came into my life found out it in a matter of hours that I have a bleeding disorder and what it entails, and so far it doesn't scare anyone away. Most of all, I'm grateful to have the opportunity to teach others how to establish a vein path, to make a factor for themselves how to deal with bullies and mental health. The main advice I will give to the patients who have been struggling with the same or similar problems is simply this: believe in yourself. If you sense something isn't right, don't hesitate to get it checked out. The earlier you seek treatment, the higher your quality of life can be, and keep people close to you and teach them how to help you when you can't handle it anymore. Thank you.
Thank you so much, Annabel. Thank you. Katie?
Yes, let me put on my video. Yes. Hello, my name is Katie and I'm from the Netherlands. And first of all, Daria already said it, but I would like to say thank you for everyone who is joining us at this webinar and also at the webinars we had before. So proud that the webinars are here and on everyone who has made them possible. I think I can say that it is a privilege to live in the Netherlands with a really good healthcare system. But when we as a family were diagnosed with VWD years ago, the doctor made it really clear that it was just VWD and not hemophilia. I think nowadays it's something we still hear a lot of people. The many questions we had as a family were not really answered back then. And we were called multiple times over worried moms and dads. And we just had to stop asking questions, and it is what it is. When we saw a leaflet in the treatment room of a camp for families with a bleeding disorder, we were happy and we were asking the doctor, can we join it and where is the camp from? But as the doctor said, we only had VWD, not hemophilia, so we cannot join these kinds of camps. We became very insecure, scared to call the doctor when there was a bleed on with one of my daughters. And we searched multiple times on the internet for more information. And she might get tired about hearing this, but at the internet we found an amazing woman. And I think it is important to say that we can all make these difference for each other when we search for more information or help or not getting our questions answered. But this person, she told me everything. She educated me. She supported me. And most of all, she helped me advocate for my daughter's treatment. It changed our world. And I think after all she had done for me and for our family, we were able to have good equal conversations with our doctors. Not something the doctors always are happy about, because they, we think the doctors are giving one treatment and think that's the best treatment, and we are not always getting all the options told. So emotionally not being heard with the doctors, with the nurses, not being taken seriously with having VWD, that seriously did something with me, but also with our family. And when I look back now, I wish we had have got proper information. We would like to have information or guidance about the first menstruation with our daughters. What can we expect? Is there something to expect? What should we do? But multiple times we were just not being heard. And I think as a patient and as a mom, that is still affecting me and our family these days. Even we are living in the Netherlands and we have multidisciplinary, how do you say it? Multidisciplinary treatments and different doctors who helped us out and think with us. It's still getting back to, you are still having VWD and not hemophilia. And I think that is something that I would like to speak out about it today.
Thank you, Katie. Thank you so much. And I give the floor to Linda.
Thank you. Do you see my slides?
Yes.
Good. Thank you for inviting me to this webinar. And it has been really interesting to listen to your personal stories, Annabel and Cathy, even if some of it is sad to hear. I'm going to speak about quality of life out of a healthcare provider's perspective. And my name is Linda Myrin Westesson, and I'm a bleeding disorder nurse working at Sahlgrenska University Hospital in Sweden. Quality of life is a broad concept that includes various aspects of an individual's well-being, including physical health, psychological state, social relationships, and personal fulfillment. It is the key measure used in different fields such as healthcare, urban planning, and economic development to assess the overall satisfaction and functioning of individuals and communities. Key factors that affect quality of life is good health and access to healthcare services significantly contributes to a higher quality of life. Chronic illnesses, disabilities, and poor medical care can negatively impact daily living. Emotional stability, stress levels, and access to mental health support are important for every person's well-being. Strong family bonds, friendship, and community support enhance social well-being and contribute to a fulfilling life. Financial security and employment opportunities plays a major role in improving an individual's and a society's quality of life. Clean air, green spaces, and safe neighborhoods and good living conditions are fundamental to high quality of life. And last, access to good education and lifelong learning opportunities are also important aspects. Health-related quality of life is a subset of quality of life that specifically focus on how health conditions, diseases, and medical treatments impacts an individual's daily life, well-being, and ability to function. It is commonly used in healthcare research, policymaking, and clinical practice to rate patient outcome and guide medical interventions. The key components of health-related quality of life is the ability to perform daily activities and overall physical health, mental resilience, stress levels, depression, and cognitive function. The impact of health on social interaction, work and life balance, and relationships. Chronic pain and its effects on daily activities and the overall well-being. And the individual's subjective evaluation of their own health status. So how do we measure health-related quality of life? Instruments are broadly classified into general, so-called generic health-related quality of life instruments and specific instruments. General instruments are designed to measure overall quality of life across different populations and health conditions. And it is applicable to a general population and various of diseases. And it allows comparison between different conditions, treatments, and groups of patients. It covers multiple dimensions such as physical health, mental health, social functioning, and overall well-being. But it is less sensitive to changes in a specific disease or condition. You may have heard of or yourself filled in SF36 or EQ5D. Then we have specific instruments. Specific instruments are designed to evaluate the health-related quality of life in individuals with a disease or condition like von Willebrand disease. These tools provide a more detailed insight into the impact of a specific health condition on a person's well-being. And it is tailored to a specific disease, condition, or a population. And they are more sensitive to changes in the health status related to the condition, and it provides detailed insight for clinical management and different treatment outcomes. But they are limited in comparability across different diseases or populations. And there are no well-known validated specific instruments to measure health-related quality of life in people with von Willebrand, at least to my knowledge. But there are quite a few for hemophilia. And I think this is something we are really missing in the clinic care. Hemophilia von Willebrand has its own specific challenges in the daily life, and it would be beneficial if we could capture that in a standardized way across different countries. While much focus has been placed on the clinical management and treatment of von Willebrand, the impact of the condition on the patient health-related quality of life is an area of growing research interest. Understanding how von Willebrand affects daily life is necessary for improving comprehensive care and developing personal-centered treatment approaches. Managing daily life with a chronic illness like von Willebrand means that the patient needs to take a lot of responsibilities for her own care. And as you all know, persons with von Willebrand often experience frequent and prolonged bleeding episodes, which can make daily life activities difficult. Some persons may limit social interactions or avoid certain activities to prevent bleeding, leading to isolation and a reduced quality of life. Adults with von Willebrand might struggle to maintaining steady employment due to frequent health-related absences. Treatment costs and medical expenses can add financial pressure, making long-term disease management stressful. And women with von Willebrand face additional challenges due to female-specific bleedings. Joint bleeds have been found to reduce health-related quality of life in patients with von Willebrand. Those experiencing joint bleeds and arthropathy report lower levels of social participation compared to patients without these complications. This highlights the importance of prophylaxis for patients with severe bleeding phenotype von Willebrand and recurrent joint bleeds. Studies showed that a reduction in frequency of joint bleeds after the initiation of prophylactic treatment. So secondary prophylaxis plays an important role in reducing the burden of joint bleeds and arthropathy, and thereby improving the well-being for von Willebrand patients. Heavy menstrual bleeding is a common symptom in individuals with bleeding disorders, including von Willebrand. It affects physical, emotional and social well-being, leading to a reduced health-related quality of life. Excessive blood loss can lead to iron-deficient anemia. Severe bleeding episodes may require frequent medical interventions, including iron therapy or even blood transfusions. Chronic pain and discomfort can interfere with daily activities. Feeling of embarrassment and frustration due to leak concerns or frequent changes in sanitary products can lead to low self-esteem and withdraw from social interactions. Menstrual bleeds can contribute to mental health challenges such as depression due to its persistent impact on life. It comes every month. Menorrhagia, which is heavy menstrual bleeding, often results in school and work absence. The financial burden of managing bleeds, including the cost of sanitary products, medication, and hospital visits, can be significant. Social participation may be limited as individuals may avoid activities due to fear of excessive bleeding. Early diagnosed and individualized treatment strategies, including hormonal therapy, antifibrinolytics, desmopressin, and von Willebrand factor concentrate, can help improve health-related quality of life. But raising awareness and improving access to specialized care for individuals with heavy menstruation bleedings is essential for a better long-term outcome. Women with von Willebrand who experience heavy menstruation bleeding have a risk of developing iron-deficient anemia. The bleed leads to excessive blood loss, emptying the iron stores in the body which are needed for producing healthy red blood cells. Iron deficiency and anemia are not just a medical condition, they have a profound impact on daily life. Cognitive function, physical health, and overall well-being can be severely affected. Individuals with anemia often experience fatigue, weakness, dizziness, and difficulty to concentrate. which can negatively impact school performance, work productivity, and social participation. Given these risks, early diagnosis and regular monitoring of iron levels are important. Regular follow-ups can help prevent long-term complications and improve quality of life for women with heavy menstrual bleeding. Oral health is another important part of the overall well-being. Yet many von Willebrand patients suffer from oral conditions that negatively affect the health-related quality of life. One of the most common issues is gum bleeding. Patients with von Willebrand can face barriers when it comes to dental treatment. Some are refused care due to the bleeding disorder, as dentists may hesitate to perform procedures. Sometimes it is a lack of communication between the coagulation center and the dentist that can lead to unnecessary delays in treatment and increased oral health complications. On the other hand, some dentists don't listen to the patient and neglect the increased bleeding risk. For patients with von Willebrand, regular dental checkups and preventive care are important to avoid complication. However, pre-treatment planning should be made by the coagulation center. Hemostatic treatment such as von Willebrand factor concentrate should be used when needed. Patient education on oral hygiene is key to prevent gum disease and reducing bleeding risks. By improving awareness and communication, we can help to ensure that von Willebrand patients receive the dental care they need and thereby improve their well-being. A recent study found that nearly 30% of patients with von Willebrand are lost to follow-up. This is a serious concern as lack of regular medical monitoring increases the risk of developing iron deficiency along with other complications. So why is the follow-up so important? Without consistent medical checkups, iron deficiency can go unnoticed and eventually become the patient's new normal, leading to chronic fatigue and weakness, reducing cognitive function, affecting work and thereby affecting work and school performance, and the increased risk of complications related to bleeding episodes. Patients with von Willebrand, especially those with heavy menstrual bleeding or frequent bleeding episodes, should attend schedule follow-up with the team, monitor iron levels regularly, and take preventive measures such as iron therapy when necessary. Now I present some data from a study we did on parental burden among parents of children with von Willebrand. We did a study because parents of children with von Willebrand may face a multitude of practical and psychosocial demands. As you know, the child needs extra supervision and care, treatment, and regular hospital visits. Parents need knowledge about disease management and how to recognize and treat a bleed. Furthermore, the parents may need to reduce working hours and have difficulties with childcare or high medical cost. So we did a multi-center cross-sectional study in the 3 coagulation centers here in Sweden. 70 parents to children with moderate and severe von Willebrand were included in 2021. A questionnaire developed for the study was used for the collection of psychosocial and psychodemographic data, and a scale that assesses the burden for caregivers of children with bleeding disorders, and SF36 was used. The results showed that parents reported a higher burden if the child was diagnosed due to a bleed rather than due to hereditary reasons. The parental burden was also higher if the child had 1 or more bleeds in the last 12 months. The parents of children who had prophylactic treatment with factor concentrate also reported a higher burden. Parents reported a higher burden if von Willebrand disease had an impact on what the parent allowed the child to do. The parents reported that these limitations appealed mainly to the child's participation in physical activities and sports. Parents reported a higher burden if the child had been absent from school for 2 or more days in the past 12 months due to von Willebrand. Parents also reported a higher burden if the child von Willebrand affected their own life in general and if the child von Willebrand had a financial impact on the family. No difference in burden were observed if the parent had von Willebrand themselves or not, or between parents of children with different subtypes of von Willebrand. I would also like to present some differences between boys and girls reported by the parents. The girls had an average of 5 days absence from preschool school in the last year, and the boys had an average of 1.8 days absence due to von Willebrand in the whole cohort. The difference between the girls and boys were even larger in the group of children aged 11 to 17 years. The girls in that age group had an absence of 5 days and the boys 0.5 days in the last 12 months due to von Willebrand disease. Also, as a consequence, the parents of girls reported a higher frequency of absence from work due to the child's von Willebrand. 1/3 of the parents, the fathers to a higher degree than the mothers, reported that the child's von Willebrand had affected their life in general. Half of the fathers and 1/3 of the mothers reported that the child's von Willebrand had an impact on what they allowed the child to do. And 10% of the parents and 1/5 of the fathers reported that von Willebrand had a financial impact on family life. And this is my last slide. Improving the health-related quality of life for individuals with von Willebrand requires a comprehensive approach that extends beyond clinical treatment. While medical management is essential, addressing physical, emotional, and social challenges is equally important to ensure a better long-term outcome for patients and their families. Healthcare providers must recognize that von Willebrand disease affects more than just bleeding control. By incorporating psychosocial assessments into regular clinical follow-ups, we can improve patient adherence by addressing mental and emotional well-being. Identify parents and caregivers who experience a high level of stress and burden. Provide support and resources to help families navigate the challenges of managing a chronic bleeding disorder like von Willebrand. A person-centered approach is essential for enhancing the health-related quality of life in individuals with von Willebrand. By addressing both medical and psychosocial aspects, healthcare providers can help patients lead healthier, more fulfilling lives while minimizing the long-term impact of the disease. Thank you for listening.
Thank you so much, Linda. Thank you for such important information that you provided. And we already have quite a few questions in the chat. So I will start probably with the first one that we received. I guess it goes to the patient representatives. The person is asking what bleeding into the joints looks or feels like. What are the signs or symptoms?
I think Annabel is the better person to answer this because I have no joint. I can only tell what I see with my children.
And of course, we have quite a few representatives of the EHC Willebrand Disease Committee. So if they also want to comment on that, you're more than welcome. Annabel, would you like to comment?
Yeah, I can. It's the severe pain, and also you can't move your. It's like if you have the joint bleed in your leg, you can't just walk. You have to sit down, and but it's me, so I don't know if everyone feel that. And also the hematoma occurs in the area, and I also feel a bubbling, like you gonna put your hand in the bubbling water or something like that in the joint. So I'm not sure if everyone feels that, but it's me. So
Yeah, I see the comments to this from the EHC VWD committee members saying that if you have it, you will feel it and you will know that it is happening, and also that it's mostly pain and bubbling in the joint, but mostly pain. So I guess it's pretty similar to other people as well. Mariangela, do you want
Thank
to?
you. Yes, thanks to all of you. I can take the next question. So what's the best time for check ferritin and hemoglobin level before, during, or after the menstrual bleeding?
I think the best thing is to check it. It doesn't matter so much when you do it, but to do it regularly. And I mean, if you have a heavy menstruation bleeding, you should check it afterwards. But the most important, the key message is to check it and do it regularly, so you can treat with iron. The menstruation comes so regular, so it's, I mean, you can't, some have for more than 10 days, so it's just check it. That's fine.
Then I have
Thank
a
you.
question from Katie. Do you want me to read, Katie, or you want to ask yourself?
No, I can ask myself. It's for Linda, obviously. How do you think we can improve the mental health issues parents are going through, especially when they have a child with VWD? Because I know in the Netherlands, we have social workers where you can talk to, but it's mostly the children are going there and not you as a parent. And when you have questions, in my case, I will hear multiple times that I'm an overworried mom. And like when my daughter, the youngest one, had her first menstruation, I would love to be a little bit prepared before of what we could expect. Yeah, there's not much for that in the Netherlands, of not in my experience.
Yeah, I'm sorry to hear that. It's, I think the more education the parents have, the easier it is to deal with the illness. And I think that it's important that we take time in the beginning of the disease to, the more time you put into educate parents in the beginning, you save that time later because you reduce the worries. And also with knowledge, I mean, you know what to do. So it's easier to deal with the child's illness. So I think the best advice I could give to my colleagues is to give the family a lot of time in the beginning. And it doesn't matter if the diagnosis is set when the child is 11 or when it's 3 or 1. It's in the beginning you should put a lot of time and have regular checkups. And also, I think having another family, as we have in Sweden, we have like contact families, that you will get a family that have the same diagnosis, but maybe a child that's a little bit older that you can talk to as well. That might give some support. But basically, to have the clinical visits are allowed to take time. It's okay to stay here long and ask questions.
Yeah, we have a patient organization in the Netherlands as well, and I'm volunteering in that organization also. But when we first were diagnosed, they never told us about the organization, the patient organization, because it was just from Willebrand disease. And I think we still hear that a lot. So I think maybe it should start with the doctors to change that and help educate patients and parents more often in the beginning. Thank you.
Thank you. And one related question also that we have received, so we remain in the quality of life domain. So is, what other strategy do you recommend to improve quality of life besides health and treatment? Are there suggested sport or activities that can help?
Annabel or Cathy, do you want to answer, or do you want me to answer? Okay. So I think that every person, you should be allowed to do the sports that you like, and we will change the treatment so you can do it in a reasonable box, of course. I mean, you might not want to start with MMA fighting, but it's important that we, in the healthcare, that we get to know if you want to do that sport, and we can change the treatment for it. And also, I think one thing that I think is really important is for my von Willebrand patients, I really want them to learn home treatment if they are in the need of von Willebrand factor, because that will improve the quality of life, I think, because then you can give direct treatment when you are hurt, or you can give preventive treatment as well. And I think tradition, at least here in Sweden, we are much more keen to teach hemophilia parents and hemophilia patients to do home treatment, but we should be as active to treat von Willebrand patients and von Willebrand parents home treatment as well. And I think that is especially important for women who has menstruations. I don't know if that will answer on the question.
Thank you so much. I will address the next one. So first of all, thank you to all three of you for being great. And Linda, I really enjoyed your presentation. My question to you is, what can we do so that health systems put more focus on the quality of life in health in patients with von Willebrand disease, especially in women and girls? It's a difficult one.
It's a difficult one. And I hope that the research is more, it's coming more studies about von Willebrand and other bleeding disorders and women's unique situation with the female bleedings. And also, I think one thing would be to produce more quality of life tools that we can use on von Willebrand patients. I would really like one to have here in our clinic. And also, I think the patient organization that have lately addressed the issue more is important as well. We need to work from different ways around it, because there's been too much focus on hemophilia. Yeah.
It's very pleasant to hear. Thank you so much.
And thank you. So we'll take one question that is related to a topic we were discussing before, so more on the role also of the educational resources and patients' organization also. So do information packs help to newly diagnosed patients and families? I guess according to your experience.
Could you please repeat? I lost the internet a bit here.
Yeah, so it was referred to what we were mentioning before, so the educational resources for patients. And so by asking, do information packs help to newly diagnosed patients and families?
Yeah,
Yeah.
I think they really do. Information, yeah, it's very useful.
Thank you. And then there is one question for Cathy and Annabel. So Annabel, thank you very much. A pleasure to see you again. Has your quality of life changed with prophylaxis? What do you say to those people who still doubt about prophylaxis in patients with von Willebrand disease? And for Cathy, always a pleasure to hear from you. Thank you. My question to you, do you think your daughter will be able to achieve a better quality of life than we have had? How do you see the future? Of course, if you want to take this question as those are more personally, feel free also to share what you want, or don't share if you don't feel comfortable.
My health has improved thanks to the prophylaxis. I can do sports again and I bleed much less. And I definitely recommend prophylaxis to everyone because it improves the quality of life a lot.
I have two daughters, one with a more severe type of von Willebrand disease, and she is having prophylaxis during her menstruation. But we start giving the prophylactic treatment when she is already starting her period. So I think there is more to achieve for her in even a more better quality of life. But it's a difficult talk with the doctor again and again. And I think it's the prophylactic treatment with the menstruation. It's in the Netherlands, it's not very often a given treatment. And when I look at myself and in comparing with my daughters, I think because of the movement and the little steps we make together, I at least hope they have a better future than the experience I have had in the past. But there's still a lot of work to do, and we have to do it all together with clinicians, doctors, everyone else. So I think I see the future very bright for them, but there still are many goals for them to achieve.
Thank you so much, Katie. I don't see the questions popping up in the chat. So meanwhile, we're waiting a bit more. Of course, I want to tell you that you can raise your hand also if you want to ask just like that. And to the newly diagnosed patients, please do reach out to your patient organization in your country. In the chat, I send a message with the contact details of the EHC national member organizations. Of course, if you are outside of Europe, you can also check the contact details of any local organization on the website of World Health Organization. Please seek support of your peers, of clinicians, and just do not stay alone and silenced. We are there to help you out with all means. So no more questions. I don't know if we want to wait more or we will wrap this up.
Yes, this was usually the moment when we advertise the next session, but as is the last one, there is this void to cope with. So I think we can wait one more minute to see if a question is arriving. So yes, I have a comment in the chat from Viva. Remember to ask your national patients organization to shift focus to von Willebrand disease too. We need more committees around Europe. Don't take no for granted. Thanks, Baba. Very motivational. Thanks so much, and very right. Also, indeed, the role of the patients' organization is key for increasing health outcomes, for mental well-being, for patient therapeutic education. So it's really important to be represented and to feel less isolated also with a disease, most if it's a rare one. So I really encourage what Baiba recommend.
And I think there is one thing that we actually have forgotten to say at the beginning of this webinar, that of course this is the last webinar, but our work is not finished at all. In education and in support of von Willebrand disease community. As I said, first of all, at the EHC we have plenty of projects already concluded and ongoing, but also we're going to continue with the ERN-EuroBloodNet. And Mariangela, I give the floor to you.
Yes, thank you.
That's the project that you already love a lot.
So thank you. So indeed, so all the videos, some videos are already available of the past sessions, but of course we are going to make available all the videos of all the session we did. So please share those educational resources if by any reasons you want to translate them in your national language, please contact me or Daria or both of us, and we can arrange that. Of course, I mean, it will be more on your level to work, but like for receiving the resources, don't hesitate to share them. Then also the idea behind this program was also to develop a patient journey, which is like an informative document for people living with Willebrand disease, but also it could be worth it for not specialized physician or nurses or healthcare professionals that are not into the expertise of Willebrand disease, where there will be all the health steps that a person living with Willebrand disease face during the life. There will be also some thematic specific, like female topical area, like pregnancy and menstruation. So of course it will take a moment for developing that material, but this is the idea of like extrapolate the content from this program and provide other tools for increase the patient awareness, but also for using them with the health professional, because we know sometimes we face a lack of knowledge even in the person that works in health that happen a lot with rare disease. So you will hear from us, and so well, it's sad to close the program. I want to thanks again, well, first of all, for this session, our speakers, for having shared with us your expertise and time, and so thank you very much for having contributed to this program. And then, of course, I want to thank all of you for your participation. And last but not the least, to my colleague Daria and to the EHC and the Willebrand Disease Committee. So thank you very much, because as I said before, it's not rhetoric, it's Nick true. Without you, it wouldn't have been possible. And thanks also to Baiba Zimele, who has really put together and put the enthusiasm and idea. The first idea came from her. So thank you very much, Baiba, for make this possible also. So thanks to all of you.
Thank you, everyone. And I want to read the message from Julia, because it's important to all patient advocates. Please try to attend as many webinars, EHC events, national societies events, to meet other patients, to hear their stories. Julia says that her knowledge personally improved a lot since she started to be actively involved and started to look for other experiences. She also had a delayed diagnosis at the age of 25 with no family history. And the most she has learned, she learned from VWD community, not the clinicians. So please, as I already said so many times, reach out, stay in touch, and thank you again very much for everything, to everyone being present here, and of course to everyone who will watch this webinar, because even just watching the webinar, you enhance your knowledge, and probably we all can make a difference. So thank you all. And
thank you.
I wanted to say we see you at the next webinar, but we won't.
Yes, it's clear.
Thank you.
Thank you. Bye-bye.